future nurses, come closer. Let's talk about the presumptive, the probable, and the positive signs of pregnancy so you know when you are pregnant. I'm just joking. Stay with me. Now, let's go. Now, presumptive signs of pregnancy are signs the subject, that is the woman, feels, right? And this can include amenorrhea, that is no period, or missed period, nausea and vomiting, fatigue, breast tenderness and enlargement, frequent urination, quickening, that is fetal movement felt by the mother, and skin changes like linea nigra, that is dark line on the stomach, right? So that is for presumptive. Now, probable signs. Probable signs are objective, that is they are observed by the examiner, that is they are signs observed by the doctor, by the gynae, which are carrying out of pregnancy tests, like positive pregnancy test. Godel's sign, that is softening of the cervix. Chadwick sign, that is bluish discoloration of the cervix or vagina, right? Heger's sign, that is softening of the uterine isthmus, right? Ballotment, that is the rebound of the fetus when tapped. If the doctor or the gynae tap your stomach and the baby jump, right? That's ballotment. Abdominal enlargement, and lastly, Braxton Hicks contractions, which are fake contractions, right? And now, positive signs. These are diagnostic. They are definite proof of pregnancy, definite proof that you are pregnant. First is when the doctor hears the fetal heart tone through the Doppler or fetoscope, okay? The fetal movement palpated by the doctor or the examiner, that is they feel the baby move, the fetus move in the belly. And the very last one, the most accurate one, visualization of the fetus on ultrasound. That is, during the ultrasound, they actually see the fetus growing, and this is the positive signs of pregnancy. So never mix them up again, okay? Bye. Nursing students, I heard you guys mix this up always on your exam. So come close. Let me simplify the stages and phases of labor for you. Now, let's go. There are 4 stages of labor, while the first stage of labor have 3 phases. Now, the first stage of labor is the cervical dilation, which is the longest stage. This stage begins with the onset of true labor contraction and ends when the cervix is fully dilated up to 10 centimeters. Like I said, it has 3 phases. The first phase is the latent phase, which is the early phase, and this is the cervical dilation from 0 to 3 centimeters. In this phase, the mother experiences mild irregular contractions between 5 to 30 minutes thereabouts. And the behavior of the mother in this phase is the mother is talkative, excited, they have manageable discomfort at this phase. The next phase is active phase, which is cervical dilation from 4 to 7 centimeters. In this phase, the contractions are moderate, regular, usually from every 3 to 5 minutes. The mother's behavior during this phase is focused. They can't talk, they are in pain, and focuses on how to relieve the pain when the contraction comes. And the last phase in the first stage is the transition phase. And this is when the cervical dilation is 8 to 10 centimeters. The contraction is strong between 2 to 3 minutes. And in this phase, the mother's behavior is restless, irritable, nausea. So take note that transition is the most intense phase. It is short but very painful phase. Now let's move to second stage of labor. This is the delivery of the baby stage, and this starts when the cervix is fully dilated 10 centimeters and ends with the birth of the baby. And this stage can last from few minutes to 2 hours or more. And stage 3 is the delivery of the placenta, and this stage begins after the baby has been born and ends when the placenta is delivered, usually within 30 minutes. And in this stage, the nurse should monitor for fundus, firmness, vaginal bleeding, and signs indicating placenta are separated, such as gush of blood or cord lengthens. And the final stage is the recovery stage, usually first 1 to 2 hours postpartum. And the nurse should focus on maternal stabilization, monitor the mother's vital signs, fundus, firmness, lochia, and bladder status. And don't forget that risk of hemorrhaging like bleeding is high in this stage. And guys, this ends our difference between the stages of labor and phase of labor. I hope now you can differentiate them.